In this video, we're going to talk about the cells that are found in the integumentary system, about the functions of skin, about skin color and diagnosis, skin cancer, and burns. The cells that we see in the epidermis include keratinocytes, dendritic cells, melanocytes, and Merkel cells. Keratinocytes make up the majority of the cells that we see here, and they produce a fibrous protective protein called keratin. Keratin is like a waxy substance that prevents water loss. Dendritic cells, like we see here, are a type of immune cell. Dendritic cells are macrophages. Macrophages means big, phage means eater. So dendritic cells are cells that eat substances, bacteria, broken down cells, etc. We have melanocytes. Melanocytes are the melanin producing cells, and so here's an example of a melanocyte. And we have Merkel cells. Merkel cells are found right here, and these are involved in sensory perception. The skin has many functions, but the function that we're probably most familiar with is protection. The skin protects us by producing chemical, physical, and biological barriers. Chemical barriers include skin secretions that are low in pH that create a layer that's slightly acidic called the acid mantle. The acid mantle prevents bacteria from being able to grow and multiply. In addition, skin produces melanin that protects the skin from UV damage. The physical barriers of the skin include the tight connections between the epithelial cells, which makes the skin like a continuous sheet, and the hard waxiness of the keratinized cells, which prevents water loss. The biological barriers include dendritic cells, which are immune cells that can act as macrophages. Macro means big, phage means eater, so big eaters. And also the DNA. DNA actually can absorb UV radiation and then dissipate that UV radiation in the form of heat. The skin is really important in thermal regulation. It helps us control our body temperature by sweating and causing constriction of the blood vessels. Sweating obviously cools us down. Constriction of the blood vessels is going to help us prevent heat loss. Sensation is another really important function of the skin. Many of our sensory receptors, nociceptors that sense pain, thermoreceptors that sense temperature, all the various pressure and touch receptors are found in our skin. And so our skin is a kind of middle person between the external environment and our central nervous system. In addition to all of these receptors, touch is such a hugely important part of life for humans. And so, there's been studies where babies who haven't received enough touch don't gain weight. They are diagnosed with failure to thrive. They don't grow. And so that's a very visible effect from not having human touch. But as we get older, people who do not have regular human contact are definitely more prone to depression, more prone to anxiety. And considering the current pandemic, that's a huge issue because we're all isolated in ways that humans don't typically do very well with. So that's something that's really important to think about when we think about providing care to patients. The skin has important metabolic functions, particularly its role in synthesizing vitamin D. Vitamin D is very important in calcium absorption, and it seems to have some sort of effect on people and survivorship with COVID. So it looks like people who have low levels of vitamin D are more likely to get COVID-19, are more likely to experience significant symptoms So we should all be going outside and basking in some rays so our skin can produce enough vitamin D. The skin functions as a blood reservoir. Up to 5% of the blood in our body is held in our skin at any given time. When it's needed to go elsewhere, it can be diverted to those areas. And last but not least, excretion and absorption are also important functions of the skin. There's a bit of oxygen that can be absorbed from the air, and that's going to provide kind of an exterior epidermis with oxygen. Medications like nicotine patches, birth control patches can be absorbed through the skin. We excrete urea, salts, and sweat as well through our skin. The next topic we're going to talk about is skin color and diagnosis of medical conditions. I think it's really important to acknowledge the fact that all of these skin color changes relate to how they look in people with Caucasian skin. I've added an article in this week's material that talks about the lack of diversity in education about skin color changes and diagnosis. And so, we're not there yet. There's not readily available materials that talk about what different conditions look like in different skin tones. But I want you to be aware that, somebody with very dark skin, if they have cyanosis, it will not look as blue as it looks like in somebody with very light skin. So, just going to go through these terms, and again, please remember the caveat that these terms are based on Caucasian skin. So cyanosis is a bluing of the skin that happens with low oxygen and or low hemoglobin levels. Erythema is redness of the skin. This happens with fever, hypertension, inflammation, and allergies. Pallor is blanching or whitening of the skin. This can happen with anemia, low blood pressure, fear, or anger. Jaundice is the yellowing of the skin, and sometimes it also is yellowing of the eyes. So this little boy has yellowing of the skin up here and yellowing of the sclera of the eyes. And this happens often with liver disorders. Bronzing of the skin can happen with people who have not liver disorders. Bronzing of the skin happens with people who have Addison's disease. It can also happen with pancreatic cancers, liver cancers, that type. And so bronzing of the skin, people's skin really has kind of a metallic-y, goldenish, pinkish tint to it. And then bruising. Bruising is when blood clots and gets trapped under the skin. And so most of us have experienced a bruise or two in our life. And so that can be anywhere from a really dark brown or black to a yellow, and every color in between. Next, we're going to look at skin cancer. Now, many of us have bumps and growths on our skin, and the majority of those are benign or not cancerous. They're not going to spread or metastasize. But some of these bumps that we have may develop into cancer. Risk factors for developing cancer include exposure to UV radiation and frequent irritation of your skin. The first type of cancer we're going to look at is basal cell carcinoma, up here on the left. It's the least malignant and the most common. It originates in the stratum basale, and the cancerous cells are going to make their way through the epidermis to the upper layers and also invade down into the dermis and the hypodermis. For the most part, a dermatologist can just remove the cancerous tissue and the person will recover without any trouble. The next most common skin cancer is squamous cell carcinoma. With squamous cell carcinoma, you see scaly reddened papules on the scalp, ears, lower lip, hands, and sometimes on the nose. This is a cancer that does tend to metastasize or move away from its origin. It involves the keratinocytes of the stratum spinosum, but there's a pretty good prognosis if it is caught early, removed surgically, and then treated with radiation therapy. The last type of cancer we're going to look at is melanoma. Melanoma is cancer of the melanocytes, and while it may look just like a overgrown mole, it's actually the most dangerous cancer. It's highly likely to metastasize, to move away from its point of origin. It's very resistant to chemotherapy. It's generally treated by surgical removal, and when people remove it, they actually remove a very large part of skin, because often with melanoma, there's pieces underneath that are spread out from the part that you can see of the epidermis. The way that you identify melanoma is by the ABCD or ABCDE rule. Asymmetry, so this is not a little circular mole. We see that there's the right and left side are not symmetrical. The border is very irregular. The color includes black, brown, and other shades. The diameter is larger than a pencil eraser, and it changes shape over time. Our last topic is the topic of burns. Burns are tissue damage that are caused by heat, electricity, radiation, chemicals, and they cause the proteins in our tissues to unfold, okay? And so when a protein unfolds or denatures, it's no longer functional. It also kills the cells in the area of the burn. Burns are classified by their severity. First degree and second degree burns are considered partial thickness burns because they don't go fully through the skin. A first degree burn only has epidermal damage. You'll see redness, swelling, and pain. Second degree burn is the epidermis and the upper dermis. We're going to still have redness, swelling, and pain, but we'll also have blisters. Third degree and higher degree burns burn the full thickness of the skin. Something that is interesting to people is that third degree burns actually hurt less than second degree burns because the nerve endings have been destroyed. Also because there's nothing to hold in the fluid. It's not swollen like a second and first degree burn get. The color of third degree burns are grayish, whitish, cherry red, or blackened. Usually with a third degree burn, you need a skin graft because there's no connective tissue there that would help support the formation of granulation tissue and then help support the skin growing back together. Whenever you see a higher degree burn, it means that underlying tissues and organs like muscles and bones are also involved. Higher degree burns, there's a very, very low chance of survival. The biggest threat when you get a third degree burn or when more than 25% of your body has a second degree burn is dehydration and electrolyte imbalance. If you think of significant burns that you've had, you can probably remember that they were very weepy. There's fluid coming out of them, and that fluid can come out in huge quantities and lead to dehydration. You can end up with renal shutdown, so shutdown of the functional parts of your kidneys, and circulatory shock because of the loss of water and electrolytes. So the treatment for burns includes IV fluids. It includes debridement or removal of the burned skin, antibiotics, temporary coverings, and skin grafts. And again, small burns, like small first and second degree burns, and third degree burns to some extent, are not super dangerous. We want to keep them covered and keep them clean. We don't want to expose that area to the outside air because of the likelihood of infection. But once you get 25% of your body or more with second-degree burns, or 10% or more with third-degree burns, you're really in a dangerous situation. Also, if your face, hands, or feet have third-degree burns, that's also a very dangerous situation. You might be wondering how we decide how much of a body is burned. And so the rule of nines is used. And so for the most part, you can divide our bodies into multiples of 9. So the head and neck is considered 9% of our body. Each of our arms is considered 9%. The trunk is 36%, so that's 4 nines. The genital region is just 1%, and then each leg is 18%, so 2 nines. And so you can use this as a nurse or a doctor to estimate the percentage of a patient's body that has been burned. In this week's material, you'll also see some articles and videos that are posted that will help you understand the integumentary system better. I hope that this video was helpful, and I look forward to hearing your comments and questions.